Well, good afternoon, everyone, and welcome to this session 1.4. I think the program is running a little bit late, and I expect some more people to join us when they've finished their lunch. But out of respect for some of our presenters, and particularly for our first presenter, who is in Washington, D.C., and where it's 2 o'clock in the morning now, I think we should get started. My name is Ron Waldman. I'm a professor emeritus of global health at the George Washington University in Washington, D.C., and it's a pleasure to be joined by my colleagues here and two others who are online. I'll introduce them in just a minute. I wanted to say that we'll be speaking today about migration and health, and this is a topic that fits perfectly with the theme of this year's PMAC conference. In terms of geopolitics, if any of you have seen the concept note on the PMAC website that describes this session, you'll see that it speaks of the fact that governments have fallen over the issue of migration. Not long ago, the government of the Netherlands resigned over this issue. A new election was held and a new prime minister was elected. There are many elections coming up this year during the course of 2024 around the world, and many of them feature migration issues as important subjects that the electorate of those countries will be deciding on their new governments on the basis of their migration policies. No region has been spared from this issue. In fact, so much migration that's taking place around the world is what's sometimes been termed South-South migration, and that is where many feel that this is a North American or a European problem because it dominates a lot of the news cycles that we're all exposed to. In fact, that's not the case. Let me add at this point that as opposed to what I heard in one of the plenary sessions this morning, in this session, we do expect you to learn things. This is an issue that's quite complex and that many researchers have been looking at for a number of years. We have assembled some of the best minds and analysts for the problem, and I think it should be a very informative and in some ways a provocative session as well. Let me continue with the themes of PMAC in terms of human security. There's conflict all over the globe: Ukraine, Middle East, South Asia, Africa. We're all aware, I think, of what is happening in many, many parts of the world. There are many people who have been forced to flee their homes and become unwilling migrants in the wake of those wars. That is that has direct impact not only on their human security, but on that of their families and then that on other members of their societies. Economic turbulence in the wake of COVID, we're still recovering from that. Many people have been forced to or have decided to flee their homes, their places of origins, in search of a better life and in search of greater economic security. In terms of health equity, which is a principal theme of the conference as well. Access to health care for migrants who are arriving in new countries for them is extremely difficult in most instances for the entire population. For men, maybe particularly so for women and children. But we'll have one of our presentations focused most directly on that issue. Let me remind everyone that when we speak about health, we speak not only about physical, but about mental health as well. And we speak not only of health in the moment, but we speak about short, midterm, and long-term consequences on the health of individuals. I myself, I might add, I'm a first-generation American, US born. Migration has been critical to my family history, as well as to my personal history, and this topic resonates quite strongly with me. I'm currently a migrant, having recently changed from the residence from the country of my birth, and I'm sure that many of you in the audience also can relate to the topic and have had experiences of moving from one country to another as well. I've had a relatively easy time of it, luckily, but when I think of my current situation, I think also of millions of others who, for no reason other than they are in search of a better life than the one they have, suffer outrageous, sometimes, indignities and poor treatment at the hands of both government authorities and individuals. While it may be that only a relatively small minority of migrants remain completely vulnerable and unprotected, at least officially, it remains true that most migrants are subjected to the social stigmas of xenophobia, racism, and religious discrimination. When the history of our era is told, we may very well be judged on the way we as societies and individuals have treated those of our fellow human beings who have been in the most need and required the most assistance. Our panel today is distinguished and represents learning from academia, from international agencies, and from humanitarian organizations. They have expertise in policy development and analysis, in human rights, in law, and in ethics, as well as in clinical and public health. The session today will be organized as follows. After these introductory remarks, we'll have 3 presentations, followed by a moderated discussion. And if there's time remaining, then we'll have questions and comments from the audience as well. And we'll do that 2 sessions. Our first speaker, it will deliver remarks virtually. He is Xavier de Victor from the World Bank. Xavier was the co-director of the World Development Report 2023, which addresses the issue of migration. If you're interested in this topic and have not had the opportunity to read the World Development Report, I strongly urge that you do so. It's an excellent document that has compiled the ideas and the thoughts, literally, of hundreds of experts around the world. The research is impeccable. It's an excellent, excellent both introduction to the topic and a summary of where we are now. Xavier, are you online?
Yes, Ron. Thank you. Thank you very, very much. I hope you can hear me well. Can you hear me?
Yes, now we can.
Okay. So,
welcome, Xavier. The audience said you're in Washington and it's 2:30 in the morning. I thank you so much for having taken the time to speak to us today. Go ahead.
So many, many thanks for the invitation in this important event. Let me maybe propose to go straight to a short presentation that I wanted to share with the audience that essentially aims to frame some of the conversations around migrations, migrants, refugees, and societies, the societies they're coming from, the societies they are moving to. This is drawing on a report that was prepared by the World Bank with support from a number of stakeholders, civil society, academia, international organizations. Now, let me start with a few numbers. And the key number of this presentation is 43. Let me explain this. We looked at people who live in a country where they do not have citizenship. That's about 180 million people across the world, about 20% of whom are refugees. And we found that while, as Ron mentioned, the issue of migration and forced displacement is often portrayed as a North versus South, as a us versus them issue, it is in fact far more complex. In fact, 43% of refugees and economic migrants do live in low and middle income countries. And most countries are both countries of origin and countries of destination at the same time. Let me just take one example. There are more British nationals living outside of the UK than non-British people living in the UK. Similarly, Turkey is a country of origin for a large number of economic migrants, but it is also a country of destination for large numbers of people coming from other countries. And the same in low-income countries such as Nigeria. Hence, the issue is not so much us versus some, but rather how to manage movement for countries as both countries of origin and countries of destination at the same time. We also looked at some of the drivers of movements, and I wanted especially to spend a few minutes on the question of demographics. What you have in front of you are traditional age pyramids for high-income countries in the top row, middle-income countries in the middle row, and low-income countries in the bottom of the slide. And the dates are 1950, today, and 2050. So as you see, high-income countries are aging and aging really fast. Let me illustrate with one example in the region. By 2050, which is my generation, about 1 Korean out of 6 will be over the age of 80. Now, this compares to about 1 Korean out of 100 being over the age of 80 in 2000, right? So huge and very rapid aging of high-income societies, with obviously questions around how to manage this, how these countries would be able to maintain their current levels of prosperity with such a very rapid aging. The other element which is relevant, including in East Asia, Southeast Asia, and South Asia, is a very rapid demographic transition of middle-income countries. Traditional countries of origin for migrants, such as Mexico, Tunisia, Turkey, India, Bangladesh, have all fertility rates today that are below replacement rates. And so significant questions for them too, in terms of how they're going to pursue on their development trajectory at a time of very rapid aging. How are they going to become rich before they become old? Obviously, the situation is different in low-income countries where the population is still booming and remains very young, but with questions as to whether the youth in these countries has had a chance to acquire skills that are needed in both the domestic and global labor market. So the key message from this slide is very simply to recognize that because of demographic trends that are very difficult to reverse, migration is going to become increasingly necessary for countries at all levels of income in the decades to come. Now, this is, of course, amplified by the pressures arising from climate change, which are essentially acting as a catalyst of other forces to produce more movements. To date, most of these movements have been domestic, but obviously the future of such patterns will depend on the sort of climate action that we are taking now, and whether we as an international community are successful in our efforts on climate mitigation and adaptation. Now, I mentioned that migration is going to be increasingly necessary in the decades to come for countries at all levels of income, yet we have to recognize that not all movements are the same. And therefore, the question is how to best manage migration so that it becomes a force for prosperity and development, once again, for countries at all levels of income. And as we consider this question, we recognize that countries of destination have a key role in this respect, because their policies, their approaches, the restrictions or the incentives that they provide for some movements can actually steer the nature, the scope, and the direction of migration and forced displacement. And we also recognize that there have been two distinct ways to look at these questions of cross-border movements. The first one is largely drawn from economics. Essentially, it looks at migration through a cost-benefit prism. Does migration create benefits that exceed the costs, or does migration create costs that actually exceed benefits? Now, the benefits of migration from the perspective of the destination country arise from migrants' contribution to the labor force, from their fiscal contributions. The costs arise from the fact that they are using public services, health services, among others, and also that their integration may have a cost. Now, the literature is actually quite extensive and quite unambiguous. When migrants bring skills that are in demand in the country of destination, their labor contribution exceeds or tends to exceed the costs associated with their movements. On the other hand, when people bring skills that are not very much in demand in the country of destination, then the cost may exceed the benefits. So that's what we call match, and the match of skills of the migrants with the needs of the destination economy. What's also interesting when we consider this is that in situations where benefits exceed the costs, countries of destination gain, but migrants gain too in the form of higher wages, in the form of access to better services, and countries of origin gains too through remittances and knowledge transfer. So when we are in this upper part of the matrix, essentially all stakeholders can benefit. What's also interesting is that this question of match has to do with the skills that migrants and refugees bring and their adequation to the needs of the labor market, but it also has to do with destination countries' policies. If I'm a medical doctor and I'm allowed to practice as a medical doctor, I can make a certain contribution. But if I am not allowed to practice as a medical doctor, I may drive a taxi and in the process bring a lower contribution. Now, there's been another way to look at cross-border movements, and that comes from international law. International law is mainly concerned with the motive of migrants. If people flee conflict, violence, persecution, then they can avail themselves of a refugee status under international law, which implies that under international law, the destination countries have an obligation to host these people who are then called refugees. If, on the other hand, people move because they're looking for opportunities in the country of destination, then the destination countries have a choice whether to accept them on their territories or not. So once again, a distinction between two groups of people, but this time based on what is making them move and what are the corresponding obligations under international law. Now, what we've done is essentially to overlay these two approaches: the match motive of the economy, and the motive approach of the lawyers. And as you see, this has helped us to, in a way, distinguish between four types of movements. And what you see, the small figures are meant to represent an order of magnitude, the respective order of magnitude of each of these groups. Now, as you see quite evidently on the slide, the largest number of people are people who move because they are looking for opportunities for a better life. And they choose destinations where actually their skills and other attributes will provide for a strong match of the needs of the destination society. Now, this is, when I talk about skills being a strong match, it's both high skills, but also low skills, right? What we're talking about here are people like me, a Frenchman living in the US and working at the World Bank. We're also talking about construction workers in my neighborhood coming from Central America. We're also talking about some of these construction workers being irregular migrants, right? So this has nothing to do with the level of skills, nor with the legal status, but it has to do with the complementarity of these skills with the needs of the destination economy. And as we've seen, the presence of these migrants does generate benefits from countries of destination, migrants, and countries of origin. And therefore, the objectives, the policy objectives for this type of movement is simply to try to further increase these gains, to maximize these gains for all concerned. The same applies for refugees who bring skills that are in demand at destination. Think about, the Ukrainian nurse moving into Poland. The difficulty obviously comes from the situation in the lower side, in the lower half of the matrix, when people bring skills that are only a poor match for the needs of the destination societies. And there we need to distinguish between two types of situations. First, refugees. In the case of refugees who do not have, quote unquote, the right skills, there's both a cost in hosting them, but also an obligation to host them. And therefore, the question for the country, for the host country, is how to best manage this. Now, as we consider this, we need to recognize that many refugee situations are actually not emergency situations, that in fact, many refugee situations last for decades. Before the conflict in Ukraine, the median refugee had been in exile for 13 years with no clear end in sight. And therefore, dealing with this situation through a succession of emergency programs is a little bit similar to, treating diabetes in the emergency room. It is extremely costly and it is not terribly effective. And therefore, the approach has to consider issues related to sustainability and to cost sharing. Now, the most difficult situation comes from those migrants who do not bring skills that are a very strong match, skills and attributes that are a very strong match to the needs of a destination society, and yet do not have circumstances that justify the provision of a refugee status. These movements are typically associated with tremendous levels of suffering, and I think all the speakers will talk about this. And I guess the question is whether there are ways to try to reduce the need for such movements so that people do not have to expose themselves to this sort of situation of risk. But what I would like to emphasize that when we're talking about dealing with the root causes of migration, we are essentially, or we should be talking about dealing with the root causes of this type of migration, because most migrants, those who are in the upper part of the matrix, do actually bring benefits to their destinations. Now, let me go very quickly to the remaining slides by observing that, as we look into, how to translate this into practice, we try to distinguish between countries of origin, countries of destination, and to come up with a series of recommendations. Essentially, for countries of origin, in the case of this strong match movement, this is about trying to manage migration in a deliberate way as an instrument for their own development. In the case of countries of destination, it is essentially an agenda of economic and social integration, but also of support to nationals who may be negatively affected. In the case of refugees with non-matching skills, the question is how to try to improve this match, how to try to move these people from the lowest part of the matrix to the upper part of the matrix. And that has to do with providing them with the right to work, allowing them to move to places where there are actually jobs, including them in national systems, etc. And then finally, for the people whom we've called here distressed migrants, the question is, once again, how to try to reduce the need for such movements, or to try to strengthen the skills of these people, strengthen their resilience to shocks, so that if they have to move, they can move in better conditions and actually with skills that are a stronger match for the need of their destination and societies. Now, let me just add that to develop such an approach requires a degree of international cooperation, both bilateral and multilateral. It also requires adequate financing instruments. But what I would like to conclude with is just an observation, which is that as we presented this very simple matrix across the world, I was struck by the fact that in both what I would say, what I would call right-leaning or left-leaning societies, with both right-leaning and left-leaning interlocutors. So people who are more skeptical with migration and people who are more open to migration. This resonates. I think there's the idea of distinguishing between these categories, the identification of these categories, the sort of measures that are being proposed for each category does resonate with people on both the right and the left. The difference is essentially where we place this middle bar. The difference is what constitutes a good match, what constitutes a poor match. And obviously, this includes skills. This also includes other aspects, whether people bring their families, where they're coming from, et cetera, et cetera. But I guess the point I wanted to highlight is that this makes for a very healthy discussion in many very healthy political discussion, right? What does constitute a good match at a given point of time in a given society? And what I wanted to highlight that this is also an issue that needs to be discussed for an inclusive the whole of society type of conversation that includes not only border management authorities, but also civil societies, the private sector, religious groups, and other stakeholders. So with this, let me close by reiterating the two key messages, which is migration is going to be increasingly necessary for countries at all levels of income, but that not all migration movements are the same, and that therefore they need to be managed adequately. Here we are proposing an approach that is based on this question of match and motive. So with this, let me thank you for your attention and close here.
Thank you so much, Xavier, for that excellent introduction. I think we're going to be building on the World Development Report throughout this session. We will be concentrating largely, but not exclusively, on the bottom half of your 2x2 table, as you pointed out. So thank you so much. I think I'd like to next, in keeping with what I just said, present Ellen Hansen, who is the acting director of the Asia and Pacific Regional Office of the United Nations High Commissioner for Refugees here in Bangkok. Ellen.
Yeah, that should be on, right? So first of all, thank you very much, Professor Waldman, Ron, for your introduction and the invitation to address this very distinguished gathering. I'm honored to represent UNHCR, the UN Refugee Agency, here today on behalf of the Deputy High Commissioner Kelly Clements, and I'm particularly pleased to follow Xavier de Victor of the World Bank, with whom we've worked closely to forge a new partnership to address forced displacement globally and to provide invaluable support to refugee hosting countries. I'll come back a little bit to that later, but great to see you, Xavier. I think the last time was at the end of the first Global Refugee Forum in 2019. I'll come back to that too. So, Ron, you asked me to make a few short, provocative remarks with regard to refugees and other displaced people in the Asia region, with a focus on xenophobia, racism, and religious discrimination, and along with fellow panelists to propose clear, implementable, and effective near-term, medium-term, and long-term solutions, and to predict what human migration will look like to future generations. No small task. And as a serving United Nations official, I'm not sure exactly how provocative my remarks are going to be, but I hope to provide some food for thought in any case. Before turning to Asia, let me briefly dwell on what the current displacement situation looks like. When I first joined UNHCR, way back in 1998, 25 years ago, UNHCR was assisting some 21.5 million refugees, internally displaced, returnees, and others. By the end of last year, we counted 114 million people, including 36 million refugees around the world, forced from their homes. And picking up on Xavier's distinctions, I'm focusing very much on those who are forcibly displaced. Now, this year, we anticipate this figure increasing to a staggering 130 million people forcibly displaced. So I think, as we've heard earlier today in different contexts, divisions amongst great and regional powers are playing out in what can only be described as a failure to present and resolve conflict, leading to crises becoming or remaining protracted while new emergencies arise. And Ron, you mentioned a few of those. I don't need to go through them. I think we all know the state of the world today. The climate emergency also is wreaking havoc around the world and intersecting very closely with migration and displacement. Notably, this region that we're in is the most impacted by national disasters and climate change in the world. Some assessments are that about 70 to 80% of displacement due to disasters is within the Asia region, with more than 21 million people already displaced by these impacts, and sadly, many more likely to follow in years to come. As we also all know, nothing new here, economies are collectively under pressure, deepening inequalities, particularly for the most vulnerable. In the face of growing displacement worldwide, one thing that has not changed, and I think you also touched on this, Ron, is that most refugees and displaced people stay as close to home as possible. Because, as is the case in survey after survey, no matter the country of origin, home is home, and almost all refugees want to go back home. It's also not just surveys, but statistics. Before the Russian invasion of Ukraine, well over 90% of the forcibly displaced people in the world were in low and middle income countries. Most Afghans, for example, are in Iran and Pakistan. Rohingya are by and large in Bangladesh. Syrians in Turkey, Jordan, and Lebanon, where 1 in 5 people in that small country is a refugee. While the refugee and displacement crisis is enormous and of global importance, it is mostly still in countries closest to those in conflict. And these are precisely the countries that are often struggling within their own economic, security, and development challenges. So let me turn to the region we're in today, Asia, which hosts over 14 million refugees, asylum seekers, internally displaced and stateless people. The situation in Afghanistan has led to over 5 million refugees, as I noted, mostly in Iran and Pakistan. The situation in Myanmar has led to 4.5 million refugees, asylum seekers, and internally displaced, and includes 1.7 million stateless Rohingya. Over 800,000 people have been newly displaced within Myanmar since October last year, resulting in what is now a total of 2.6 million internally displaced. I find these figures really very shocking indeed. Bangladesh hosts close to 1 million Rohingya refugees in the largest and most densely populated refugee camp in the world. In the last couple of years, I personally have met many Rohingya refugees in the camps of Cox's Bazar in Bangladesh, but also elsewhere in the region. Most fled Myanmar for their lives nearly 7 years ago and found safety in Bangladesh. Most want to return home, but the prospects of return are elusive, to say the least. International attention has faded due to lack of political will and pressure, and a focus on other pressing situations. Again, I don't need to list them, but we see it in Sudan, Gaza, Ukraine. Support for host countries, including Bangladesh, is diminishing. Coping mechanisms are becoming depleted, and continuing uncertainty has impacted mental health and led to desperation. food rations, essential in the absence of access to livelihoods, have seen cuts. They started off being $12 per person per month in Cox's Bazar. They went down to 10, then to 8, and now, luckily, we're seeing a bit of a reversal of that trend, thanks to renewed funding by some donors. It's now back up to 10% per person per month, but still not very much, even in Cox's Bazar. And this, of course, leads to health issues, which can be very visibly seen when visiting camps. As a result of loss of hope, Rohingya refugees are taking to boats and crossing borders in search of a future, any future. In 2023, 41 boats with 4,475 Rohingya on board left Bangladesh and Myanmar. 636 people amongst them were reported dead or missing, making the Bay of Bengal and the Andaman Sea proportionally the most deadly sea route in the world. 1 in 8 persons who attempted the journey last year perished or is missing. 4 boats are thought still to be at sea, and we're not expecting a reduction in departures before the end of the sailing season in March, April. Now, turning more to the more specific focus, globally, we've regularly seen refugee situations becoming politicized, especially in the lead up to elections. Ron, you mentioned the fall of a government, but sadly, some other governments will do anything they can to avoid falling, which also leads to problems. We're seeing spikes in hate speech and xenophobia through targeted social media campaigns, which permeate into wider society and political positioning. The Rohingya, in particular, have suffered from this stigmatization, and we're working very hard to counter it. It has been both a cause and an effect of their forced displacement, and they are doubly vulnerable as refugees, but also as stateless people. And let me be clear, this type of online hate speech leads to very real consequences and risks to the safety and security of refugees. It doesn't exist in a vacuum. And we've seen in some countries in Southeast Asia, in particular, they're orchestrated campaigns, many for political reasons. In my more than 25 years of working with refugees, I've never met anyone who, when they meet refugees or hears their stories, does not have sympathy or empathy for people forced to run from their homes and leave everything behind due to war or persecution. But misinformation, disinformation, and hate speech, as I said, are spreading. Many people may not knowingly have met a refugee, but yet often hold very strong and often negative opinions about them because of what they've read online, in their papers, or heard from politicians. I think it's really quite a terrifying situation. In Indonesia, for example, at present, which has been one of the countries that has been generous in disembarking refugees and providing support, and communities have traditionally been very supportive, they're becoming less supportive, and we're faced with an absolute barrage of anti-refugee and, I should say, anti-UNHCR sentiment. Every day there are multiple fake UNHCR sites popping up. It's very hard to tell the difference between them. I've tried myself. Indonesia is the second largest consumer of TikTok in the world, I understand, and it's really extremely difficult to address in any effective way. We're looking at it very closely, and there's a lot of work to be done there. So what to do? We need to work together to ease pressures on host countries and communities, enhance refugee self-reliance, expand third country solutions, and step up work in the countries of origins from which refugees have fled. And those 4 objectives, indeed pillars of the Global Compact on Refugees, which was agreed by the international community in 2018, as a complement to the international legal framework of the 1951 Refugee Convention and its 67 protocol, as well as regional instruments relating to the status of refugees. The Global Compact was designed to address the gap in international cooperation and to provide a basis for more predictable and equitable responsibility sharing among states and other stakeholders. We recently hosted, not far ago, we recently hosted the Global Refugee Forum, the second one. I just mentioned the first one was in 2019, which is the largest gathering of refugees globally. And I just wanted to mention some of the pledges before coming to a close, because I think they're quite significant. We saw $2.2 billion in financial commitments to resettle 1 million refugees by 2030 and find third countries for another 3 million refugees through community sponsorship with the help of a newly established global sponsorship fund. The private sector committed $250 million in funding pledges to boosting economies and communities, jobs for 100,000 refugees and over 400,000 training opportunities, et cetera, et cetera. A multi-stakeholder pledge promised digital protection to prevent the harmful impact of hate speech, misinformation, and disinformation. And I'll just end with, at the end of the forum, the High Commissioner concluded that the state of the world requires a reboot of humanity and energy to meet the challenges before us. He spoke to the importance of working together to address the very real challenges of mixed movements, upholding the rights of all people on the move for whatever reason or motivation, and doing more, not just for border management, but to protect and help people along the entire routes on which people move. There was reference to a new multilateralism and the importance of minilateralism. There'll be a bit more in my speech, which I'll share afterwards, but I realize that we're running out of time. So I just wanted to say, and I think it complements what Xavier said, that emergency humanitarian assistance is essential, and we need to ensure it reaches the populations in need, no matter the challenges. But it's obviously not enough, and that's where development funding comes in. And it's been a real game changer to have the World Bank work on ensuring inclusion for refugees in national systems and services. Particularly health and education have been very promising. And I should just say, we've heard a lot of negativity about COVID responses here today, I think, but actually for refugees, it was in a way quite a positive story in Bangladesh, where we saw inclusion of refugees in vaccination programs. We saw health clinics being set up for refugees and their hosts. And actually it was an example where I think communities really understood the importance of including refugees in national systems. So thank you very much.
Thank you very much, Ellen. I think indeed it was complementary to the first presentation. In the interest of time, I'd like to move along, and our next presenter will address the other box from the bottom half of the World Development Report framework. Dr. Federica Zamato is the Director of Medical Policy and Care for Europe for the non-governmental organization Médecins Sans Frontières, Doctors Without Borders. I have to say that Médecins Sans Frontières has been incredibly active in trying to provide humanitarian assistance to those migrants who are arriving in the European continent. But Federica's work includes dealing with this issue in the United Kingdom, in Belgium, in Poland, in Ukraine, in Greece. The problem is really quite wide-ranging, and I would like to put special emphasis and focus on the humanitarian aspects of the migration issue. Turn it over to you, Federica. Not on. No. Still not on.
I'd like first to thank Professor Woodman for the invitation. I'm really honored to be here today and to have the chance to share the experience of Médecins Sans Frontières on migration in Europe. I don't know if we can share the presentation. Yes. So I'm going to talk about, as I was saying, the experience of Médecins Sans Frontières in Europe on migration. We have been present in some countries now for almost 20 years. Thinking about Greece and Italy, for instance. And currently we are working in several countries. I'll show you a map in a minute. Just to set a bit the frame, I'd like to show you a bit the figures of migration in Europe, as I guess not everybody is familiar with it. Here we're looking at the figures of last year, 2023, to say that almost 300,000 people have reached Europe. Figures might seem big, but I'd like to put them in comparison with the population of the European continent, which is 741 million people. So you see, we're talking about small numbers, actually. But I'd like to draw the attention. So you see, you have highlighted in green the main entry countries. Italy actually accounting for the majority of entries via the central Mediterranean route. Being the one that allows people to arrive by boat, mainly from Libya and Tunisia to Italy. And then we have the other two main routes are the one from Turkey to Greece, and then in the western side, from the upper western coast of Africa to the Canary Islands, Spain. One would wonder why an organization as Médecins Sans Frontières, which is an emergency organization working in context of war, natural disasters, epidemics, what do we actually do in Europe? Well, when you look at the numbers, I'd like to draw your attention on the numbers in red on the right of the slide. It's the number of people who have lost their lives trying to reach Europe since 2015. As you see, last year, 3,760 people lost their lives trying to cross to Europe, either by sea or by land. And when we're looking at this at the population, just to give you also an idea of the population we are looking into, this is the breakdown of the nationalities that arrived to Europe last year. Main nationalities being Syrians, people from sub-Saharan countries, Guinea and Ivory Coast. But you can see also large numbers of Afghani, in an increase compared to the previous year of people from Tunisia, following the dire conditions of the crisis in Tunisia, indeed. So overall, when we are looking at numbers from 2014, it's 28,800 people, 807 people who have lost their lives trying to get to Europe. So that's a bit the size of what's happening. Ellen was saying it already, but specifically looking at Europe today, the environment has become more and more hostile towards migrants. The narrative held by politicians of different countries is clearly against migrants, migrants being looked at through the security lens, as migrants would be a threat for the security of European citizens. Also, what we have seen in the past years is an increased use of violence at the frontiers, violence as well perpetrated by the authorities. There are many reports of pushbacks at the frontiers, for instance, the frontiers between Greece and Turkey, but also inside the European Union, many reports of pushbacks between France and Italy, and also looking at a different country, all the violence that we are seeing perpetrated by authorities from both sides of Belarus and Poland. In the past years, and I'm sharing here the experience of, of working on migration for some years in Europe, we also have seen a decreased access to healthcare for migrants in Europe. Access that is actually declined in several examples. For instance, if I look at Greece, where we work, but throughout all the other European countries as well, there's quite a poor access to vaccination for migrants. Would it be for children or for adults? Though there are very clear policies on vaccination for migrants that are established by the WHO, for instance, but also other examples would be unadapted contraceptive care for people on the move, as well as denial of access to hospitals through ambulances, as we've been seeing several times in Poland. Reception conditions still are poor. And just if it was not clear from the figures before, today in Europe, we do not have a migration crisis. It's a constant flow. So if we take the exception of 2015, 2016, where there has been the so-called refugee crisis, where 1 million people entered Europe in 6 months, now it's just a human trend. It's no crisis. It's only politicians who are treating them as a crisis regularly, not having long-term strategies to tackle the thematic. Also, we are seeing, and it was said before, criminalization of migrants and of humanitarian workers. Started, I would say, in 2017 in Europe, but has been quite, and there are quite a lot of humanitarians, of members of civil society organizations being accused by governments of facilitating smuggling. So there are quite a few trials ongoing, and it's become more and more difficult, especially for small local civil society organizations. Of course, myself, I work for a big international organization. It's easier when you are in such a position rather than being a grassroots organization, yet not an easy position. But it's more and more present, this narrative against organizations and migrants. Also, you've seen, I guess, Europe has been a workshop for more and more deterrent migration policies, with the externalization of migration, which started in 2016 with the pact between Europe and Turkey, and continued then with the pacts with Libya. Now we have examples of the UK trying to pass the deal, the Rwanda deal, to have people sent to Rwanda for the handling of their asylum requests. Briefly, a map just to show you where we are operational today. I was telling you Greece, Serbia, Italy, France, United Kingdom, Belgium, Poland, and of course also with the search and rescue activities at sea. Well, the health needs of migrants, as I was saying before, it's a mixed population. So it's a population that is composed of many nationalities, but also in terms of age range, we are seeing children, elderly people as well, women and men. So first of all, it's a population with all the health needs of a common population, as all of us. To that, we need to add actually the consequences of continuous exposure to violence. Just to be very clear, very often the people that we see, they have been fleeing their countries because of exposure to violence or persecution. When that's not the case, well, then they are actually exposed to violence along the migration routes. And when it's not along the migration routes, it's then at the entrance of Europe as well, at the frontiers. And then it's in Europe when they arrive. So, and that's a vulnerability that adds up to the normal, let's say, health condition that people can have. As well, the journey can be very perilous, depending on the routes that we are looking at. We can see many cases of specific diseases. Would it be hypothermia in the long crossings of the Mediterranean, but also the spending of days in the forest in Poland or between Turkey and Bulgaria. But also we are seeing a disease that dates back, well, was actually described during the First World War, which is the trench foot. And of course, the consequences of the poor living conditions. People, when they arrive in Europe, if we look, for instance, at the central Mediterranean way, it means people pass through Libya, through detention centers, well, you probably saw the horrendous conditions and the violence and the torture and ill treatment people are exposed to in these centers. And then, as I was saying, to all of that, we have also in Europe a poor access to healthcare, which is, yes, poor access to vaccination, but as well, it might be, resulting in complications of otherwise easily treatable, non-communicable chronic diseases that actually worsen because people cannot access the proper care. The intervention that we would actually design will depend on, on the location. In some context, of course, people are stuck for longer. It's been the case in the past in some Greek islands where people would be stuck for weeks, months, some people for years as well. So the typology of intervention we designed is specific to the contact time we have with people as well. We would have this kind of setting, but else also countries like Serbia, where people transit very fast, sometimes being in the country only for 1-2 days. So we do consultations where we see people only one time. And also the activities depend on whether people are living rough in the street, as it's the case often these days in the European capital in Brussels, or if they are in camps or in squats or occupied buildings, with the consequences of the poor conditions as well. I see Tanis run up. Yes. So the services we will be providing would be primary health care. Mental health care is a major need. Ron was saying it before. I think it came clear from the overlapping vulnerabilities that I was mentioning, but as well, we have services of sexual and reproductive health care. We have also a project for the comprehensive rehabilitation of survivors of torture, which is one of the thematic we've been investing quite a lot in the past. Just to remind that at least 30% of people who are enter Italy passing by Libya have been exposed to torture or ill treatment. So that's the population we are working with today. And of course, because we're trying to design services that are adapted to migration, intercultural mediation is a key component of the projects that we have. These are the figures for last year. Just to give you an idea, it's not massive numbers. Also, Médecins Sans Frontières was actually founded by doctors and journalists. What we do back in 1971, what we do is providing healthcare, and while at the same time bearing witness of what we see and try to advocate for the improvement of the conditions. I shared here some of the reports we have been writing on the thematic of migration in the past years, specifically on Europe. And just I'd like to conclude by saying that arriving to Europe is not actually the end of the journey, as people might sometimes hope, but it's actually the beginning of a new, very difficult journey that people will have to endure to arrive to their final destination and potentially integrate in destination countries. Thank you very much.
Thank you for your time. I wonder if we can take a break from the presentations now, and I want to change the format a little bit and ask if there are any questions or comments from the audience on the presentations that we've heard so far. We're going to be continuing on more or less the same theme, but touching on certain other aspects of the migration issue to a greater extent. Does anyone have any questions or any comments for any of the presenters so far? Sir?
First off, thank you for this presentation. As I listen to it, I'm listening to an earlier statistics we heard in opening plenary sessions that talked about how much better we're doing today than we were in 1950. And in terms of a range of indicators, these indicators are sort of inverse to that. I'd like to speak specifically to the economic refugees. to what extent is there any effort, or has there been an effort? People are fleeing or leaving their homes. As you say, they do not want to leave their homes, but they're looking for a better life. The investment in the economies of those countries and improving the economic opportunities, to what extent there have been efforts or are efforts under discussion to increase the economic chances for those people to remain in their own country. This is above and beyond all of the conflict issues, but just differentiating on that level for a moment.
Xavier, did you hear the question?
Yes, thank you. Should I try to provide a brief response? Ron?
Yeah, Xavier, why don't you go ahead and take it?
Yeah. So many thanks for the question. Let me just try to maybe not provide a simple response, but just a few quick elements of response. The first one is to recognize that many economic migrants actually do want to leave their country. That's my case. That may have been your case, Ron, but that's also the case of many people who see migration as a way for a better future for themselves, for their children, to access better services, etc., right? So once again, I think it's important to distinguish between different types of movements. Some which are actually very difficult. I think we've heard from some of our colleagues on the panel earlier, but also to recognize that for most people, migration is actually a positive experience. So the second point, economic migration, right? And I'm not talking here about forced displacement, nor about the obviously awful situation that colleague from MSF was describing. I think the second point is that there have been lots of talks about this question of dealing with the root causes of migration, but I think we also need to turn things around a little bit, right? If for a country like Korea, not having migrants, when 1 Korean out of 6 will be over the age of 80 in just 20 years, would actually be a tremendous and almost existential challenge, right? So I think once again, we have to look at this not only in stark terms of suffering and geopolitical tensions, etc., but also in the fact that these movements are actually necessary and beneficial to many. Now, third point is that there have been lots of talks about using development to improve living conditions in the countries of origin so as to reduce movements. Actually, if you look at the evidence, it works the other way around, which is that as countries move from low income to middle income, migration does increase, not slow down. And the reason for that is very simply that you have people with more resources and therefore more possibilities to move. You also have people with better skills and therefore the possibility to move in better conditions and better circumstances. And so the picture here is very nuanced, with migration increasing up to a fairly high level of development and then slowing down. So all this maybe just to try to further stimulate the conversation.
Thanks, Xavier. That's very interesting. Ellen, I remember when we used to talk about countries of first asylum and second asylum and third asylum, and I think that relates also to the question, does UNHCR, how does UNHCR, although you say that refugees have a tendency to want to remain close to home, sometimes those countries, the initial countries, feel that they're not well equipped to bear the quote unquote burden of an additional population. So I wonder, does UNHCR have specific policies vis-a-vis the intermediary countries?
That should be okay. No, thanks very much for the question, Ron. And yeah, I mean, the reason, I guess, why we're so particular about the term refugees is because they're people who are not choosing to move on. I mean, they're actually forced to flee, and they can't return home because they would suffer human rights violations and persecution and conflict. But in terms of onward movements, which I guess is what you're asking about, and, you know, I've met people. I used to be the senior protection officer in Australia, covering the Pacific. And I spoke to, you know, Rohingya refugees who were sitting on Manus Island or Nauru. Sadly, I think the precursor of some of the policies we're seeing in Europe today. And, you know, I would ask them, you know, why did you come to Australia? And, you know, they said that, well, they'd been, you know, to one country along the way in Malaysia. They'd been in detention for, you know, a number of years. They haven't had access to livelihoods. Things have changed a little bit there. But, you know, then they went to Indonesia. They couldn't get livelihoods. Their children couldn't go to school. And then they were compelled to move onwards. So I think we would say there's no unfettered sort of way of choosing where you choose to have asylum. You know, some of the refugees were saying, I paid for Melbourne, you know, and I've got, you know, Manus. And we used to say, well, you know, we're not a migration agency, you know, we're interested in your safety and protection. So we do look at onward movement, whether it's kind of for protection reasons or otherwise. And, you know, people do move on because they need to move on. But certainly there's not a complete unfettered permission to go wherever you like, if you like. And we have setting up a task force at present, which is looking at some of these maritime movements. And, you know, the figures in Europe are very, very high. The trend we're seeing here is upwards in the same direction. But what we want to do is to make sure that people get protection as close to their home as possible, because they run greater risks the further they move on. But many do it for reasons that are very compelling.
Thanks. And I'd like to ask Federica as well from the humanitarian perspective, because you talked about the poor state of the reception centers, and I know that your organization and others try their best to provide services at those points of reception, but I wonder if you will also make an effort to make any provisions for migrants, not necessarily in the countries that they're trying to get to, but in the intermediate countries that they're crossing. We'll hear after this question and answer session about the situation on the southern border of the US. And I know that people are crossing many, many, many countries to get there. Are the humanitarian organizations able to operate along that whole journey that you've talked about, that long and painful journey?
Thank you. Thank you for the question. Yes, indeed, in Europe, we can operate all along the route. In terms of, let's say, intermediate countries, I would mention maybe two very different ones. One is Serbia, so we are outside of the European Union. People transit, as I mentioned earlier, just for sometimes few days or a few weeks. Mainly staying in informal settlements, so squats at the frontiers, trying to exit the country in the north. But then we also work in a country like Belgium, which we define a country of stagnation in a way, because it's partially a destination country, but it's also a country where people stop by trying to cross then to the UK, France, UK. So indeed, and the reception conditions are poor as well. I mean, I think it's if one goes for simply a walk in the European capital, you can see very well that there are many people sleeping rough in the city. So that's actually quite a rich network of grassroots organizations that is providing support for people on the move. MSF is also operational there. But indeed, the condition is not good in the capital of Europe neither. Yeah, thank you.
Thank you. Let me take one more now before we move on.
Yeah, my name is Espen Bjartnes from University of Oslo in Norway. I have a question for Ellen, I think. It was mentioned the high number of internal displaced people in Myanmar, and it's geopolitics on a local level. How do you reach those people when you have the military government after the coup 3 years ago, and you have NG and this civil government in the border area where most of the refugees live now? How can you help them? And also very small additional question.
I don't know if we have time right now.
Okay.
Why don't you save it until afterwards, till after the next round of speakers? I'll call on you again.
I'll be very quick. So Myanmar is really a dramatic situation at present, and our access is very difficult. Funding is extremely difficult because we're dealing with de facto authorities that are not recognized by the international community, and therefore a lot of states don't want to channel funding into Myanmar to go to non-recognized authorities. At the moment, it's also very tense inside. They're under control of different factions, basically, parts of the country. How do we deliver? I mean, our mantra is stay and deliver. And, you know, we do try to stay and deliver, but it's with a great deal of difficulty. We need visas to move even within Myanmar, to get into Myanmar. You know, we have to work with the de facto authorities as a result. But we fundamentally work through local partners because they're the people who can move, but it's very worrying because they are putting themselves at risk every day when there are checkpoints with mobile phones being checked. People are too scared to write down notes, etc. So I'm sorry, I think the simple answer is with a great deal of difficulty, but we're doing what we can.
Thank you, Ellen. I think I'd like to move on to our next set of speakers and begin with Professor Monette Zard from the Malman School of Public Health at Columbia University. I promised myself that I would say that Monette is the Alan Rosenfield Professor of Population and Family Health, and I don't know if there are any senior people from the Ministry of Health in Thailand here. But Alan Rosenfield was a man who had a very special and very close relationship with Thailand and with the Ministry of Health, and was instrumental in launching and supporting and growing the family planning program in Thailand. He was a mentor of mine until his unfortunately premature death. I guess it must be 10 years now. But every time I see Monette's title from the faculty, I'm reminded of how great a man Alan Rosenfield was. Monette is currently the director of the program on forced migration and health. I won't say anything about that. It's a program I know well as well. Monette, turn it over to you.
Great. Thank you so much, Ron. Thank you for that kind introduction and for remembering Alan. And thank you to the conference organizers. It's great to be here with you all today. So I have to say the topic of this panel, which is called Conflict, Crises, and Displaced Populations, I think could not be more timely and relevant. In my own lifetime, I cannot recall an era that felt more volatile, whether it's the Russia-Ukraine war, the ongoing violence in Myanmar, the ever-widening conflict in the Middle East, Sudan, coups in West Africa and the Sahel. It's really hard to escape the conclusion that the norm of non-aggression is fraying. That's a phrase that the International Crisis Group applied in their 2024 preview of conflicts to come. And I think this really echoes a theme we heard this morning in the plenary, which is that many countries feel that they can resolve their conflicts using force with little accountability, and that there is very little faith or trust in many of our multilateral systems or in peacekeeping efforts. So the levels of forced displacement that we've been hearing about in the earlier sessions today I think really, reflect the levels of conflict that we see around the world. And just a reminder, UNHCR is projecting 130 million forcibly displaced or stateless by the end of 2024. Now, the vast majority, as we've heard, don't cross international borders. They are internally displaced. But the levels of forced displacement across international borders, the numbers of refugees, are also at a record high of 36 million and some. Worth remembering, vast majority is still hosted in low and middle income countries and fragile settings, even with the somewhat atypical response to Ukraine in Europe. Now, I think there's no question that these numbers and the lack of political resolution to many of these long-running conflicts places a great strain on the governance systems that we have. The 1951 UN Refugee Convention, which was adopted in the aftermath of the Second World War, and the various regional refugee instruments that have been adopted since then, embody a couple of critical ideas. First of all, we've already heard the idea of responsibility sharing, and that second, the idea that those who flee conflict and persecution should be able to find safety and protection in countries of asylum. The idea that underpins this is access to territory. You need to have access to territory in order to be able to seek asylum. And so that is intrinsic to our very notion of international protection and underpins the international refugee regime as we know it. But I think against the backdrop of perhaps the greatest refugee movement of our time, we've seen, as we've already heard earlier, many countries, particularly but not exclusively in the global north, that they are using a variety of tools to essentially subvert the refugee protection system as we know it and prevent migrants and refugees alike from accessing their territories and triggering their international protection obligations. And that's really what I'd like to talk about in some more depth today. And we heard from our first speaker from the World Bank that the way in which destination countries respond to migration in part determines and shapes that displacement process. And I think this is very, very clear with respect to how we see externalization, as it's called, playing out. So I'd like to look first at what these externalization policies are, and Frederica mentioned them briefly already, and some historical and global examples. Second, to talk a little about how this is playing out at the US southern border, and then finally the health and rights consequences. So starting first with what are these policies of externalization? I think these are a broad set of migration control measures which are taken unilaterally or multilaterally by states to essentially shift protection obligations for people seeking asylum to outside of the territory of the intended destination state. And they can range from direct interdiction and prevention to more indirect policies that work through third countries, often using development aid as an incentive to essentially stop the onward movement of refugees and deflect and contain them increasingly in regions of origin and transit. The UK-Rwanda deal, which was mentioned also earlier, I think is a prime example of not just border control being externalized, but the whole adjudication process basically being shifted offshore. Now, the process of externalizing borders really took off in the 1980s. It was essentially modeled by the US with its interdiction of Haitians at sea and the use of the naval base at Guantanamo to warehouse migrants and asylum seekers long before it became synonymous for its use to deal with 9/11 terrorism. Australia also, as we've heard, had its own Pacific solution in which arrivals were held effectively indefinitely in offshore detention centers in places like Nauru. Europe on its eastern border has the 2016 EU-Turkey Action Plan, which returns to Turkey asylum seekers and irregular migrants crossing to Greece. And on its southern border, Europe, through a series of arrangements, has effectively pushed out its southern border to Niger, Libya, and Sudan through an elaborate layer of security, migration management, and development cooperation agreements. For example, the 2016 EU-Africa Action Plan, which we already heard referenced, effectively saw Europe agreeing to offer training and support to law enforcement and judicial authorities in the name of combating trafficking and smuggling. And this agreement was used as the basis for sending cameras, scanners, servers to Sudan, and dealing with the regime of Omar Bashir, a notorious dictator, as part of, a migration management plan for Europe. Niger alone, prior to the coup, was the recipient of over $1 billion of European Union development aid, most of which was channeled into anti-migration policies. And what really bothers me about this is, Niger was prevailed upon to suspend the application of the ECOWAS free movement protocol, which is an incredibly forward-looking migration management regime, which has been an incredible safety valve for refugees on the continent. But Niger was essentially asked to suspend it in the region above Agadez in order to serve European interests. And in 2015, adopted an anti-trafficking law, which has been the basis for its crackdown on smugglers and migrants. So, as I promised, the second part of remarks really will look at the US southern border and, really, I think, see the same dynamics playing out there as well. The US, again, once a key architect of the post-war refugee protection regime, has systematically been closing its doors to asylum seekers at its southern border with Mexico, blocking and containing migrants and asylum seekers in Mexico and the region. And while while some of the most egregious and explicit policies of containment were introduced during the Trump administration, we see many of these same policies essentially being continued under the Biden administration. So take COVID-19, for example. The Trump administration seized upon the pandemic and an arcane public health law called Title 42 to institute a total ban on asylum seekers and refugees crossing the US southern border, essentially warehousing them in Mexico for years, waiting for the asylum process to restart. Meanwhile, other types of migrants, tourists, everyone else was being allowed to travel, but this particular group apparently posed a particular threat of the disease spreading. And of course, Title 42 flew in the face of public health guidance, including from its own CDC, that questioned the need and scientific basis for such a measure. But when it came to power, the Biden administration, in fact, expanded the application of Title 42 and took a full 3 years to repeal the measure. And when the ban was finally lifted last year, it essentially replaced it with a new asylum bar, which renders nearly all asylum seekers who travel through another country on their way to the US and to the southern border ineligible for asylum unless they can show that they applied and were rejected for asylum in one of the countries they transited through. In essence, this is the same transit ban that the Trump administration had tried to institute that had been struck down by US courts. And this is also being litigated currently in US courts. And to further reinforce the point that asylum seekers and migrants should wait in Mexico, the Biden administration has now required all asylum seekers to use a highly problematic app called CBP-1 to apply for one of the highly limited pre-scheduled appointments to enter at an official port of entry, which essentially functions at the moment like a daily lottery. And anyone who attempts to cross the border between these designated ports of entry without an appointment is also then issued with a presumptive bar on their asylum claim. Now, that's what we see when it comes to asylum, but the Biden administration, I think, trying to be cognizant of its political base, has tried to make these bans essentially more palatable. What it's done is layer onto them a system of what they call complementary pathways, or essentially discretionary exceptions, which have been made essentially, first of all, for vulnerable individuals, and later nationality-based exceptions for groups that would be allowed to access US territory. So Ukrainians, for example, were allowed in under a humanitarian parole scheme as long as they had financial sponsors in the US and as long as they applied from abroad. The administration later then followed this with a limited number of spots which they made available for Cuban, Haitian, Nicaraguan, and Venezuelan migrants. But in a classic bait and switch, it also struck a deal with Mexico whereby it could expel to Mexico a far greater number of migrants from these same countries as soon as it hit its cap on who was to be allowed in under humanitarian parole. So to summarize, what we see playing out at the US southern border is a formalized attempt to contain, block, and deflect migrants and asylum seekers, combined with some carrots to make the whole process more palatable in the form of these highly limited, exceptional humanitarian pathways. In effect, I think what we're seeing is a reshaping of the asylum system from one that is based on rights and due process to one that is discretionary and nationality-based, where we essentially pick and choose which asylum seekers we want to admit, and where financial sponsorship becomes a defining factor in the decision-making process rather than the protection needs of the individual. Now, I know we're running up against time, so I will go very quickly through what I see as being some of the rights implications of some of these practices. First of all, there's a very real risk of refoulement, that people will be forced back to places where they might face persecution, where their lives might be at risk. Second, these policies also end up trapping asylum seekers in transit countries, which really don't have the infrastructure and were never intended to be places where these asylum seekers stayed, and where both national and humanitarian systems, I think, are really struggling to respond to the needs of asylum seekers who are trapped there for longer and longer periods, and where the very social networks that often sustain migrants and asylum seekers in other places just aren't present. And then third, as we've been hearing, while these measures may slow migration, certainly in both Europe and US, they often tout in the short term the results of these investments in terms of diminished migration numbers, they ultimately end up pushing migrants and asylum seekers alike onto increasingly clandestine and dangerous routes, increasing then mortality and morbidity. And we've heard, I think, in a very compelling way already from Francesca and Ellen about the levels of mortality that we see on these routes. States are not systematically collecting data on migrants who die. What data we have is very patchy, it's not disaggregated. The IOM has been trying to compile statistics in its Missing Migrants project. But again, they're very much an undercount of what we're seeing around the world in terms of migrants and asylum seekers who are really dying and suffering injury en route. And I think the final point that I wanted to make here is that, just to reiterate what we heard from Francesca, sort of to add insult to injury, these same governments are often using trafficking and smuggling legislation to harass and intimidate humanitarian workers who are trying to intercede to help migrants while they are en route. So we've heard about this happening in Europe. The US has been trying to do the same. And the UN Human Rights Office has really voiced its own concerns about the fact that anti-smuggling legislation is really being used to criminalize both migrants as well as those who assist them. The irony, of course, is that states increasingly dress up all of these measures in the language of protection. So they say, we do this because we're trying to stop trafficking, we're trying to stop smuggling, it's for the migrants' own protection, or actually they're subverting development aid to, in effect, build migration management systems. So in conclusion, I don't want to downplay the challenge of managing migration. The numbers are sobering. There were more than 2 million apprehensions at the US southern border last year, up 30%. And the pressures on states, even well-resourced states, are real. States do have a sovereign right to manage their borders. But I think, that has to be tempered by recognition of the fact that we see many low-income countries who have been doing a stellar job over the years hosting millions of refugees. And, that foundation of the international refugee regime really is responsibility sharing. And, what are they to think when they look and see that down the line, states further along are refusing to take on their own obligations. And I think the last thing I want to say is that we actually have seen that it can be done. I mean, the Ukraine example is almost a textbook example of how you can manage a mass influx of refugees and asylum seekers in a way that is seamless. That's not to say there haven't been issues, but really we have seen social protection systems in Europe really leveraged and used to absorb very, very large numbers of refugees in a very short time. So it is possible to do it. We just need the political will to do it. And we need a commitment to a rules-based regime, as we heard in the first plenary today, to underpin our efforts to do that.
Thank you, Monette. It makes me, I don't know why this happened, but the other day I happened to be watching a debate on YouTube from the Republican primary election campaign, but it wasn't the current one. It was from 1980. The debaters were George Bush and Ronald Reagan, and they were falling all over themselves to sing the praises of refugees and to see who would say the nicer things about refugees and promise to bring in more and allow them to bring in more because they were so vital and instrumental to the economic and social growth. Things have really changed in many, not for the better, in a relatively short period of time. Our next speaker is Dustin Barter. I'm going to refer to him as Dr. Dustin Barter because we're only days away from that title becoming official. Dustin has done considerable research on migration and humanitarian issues both in the Asia region and in East Africa. He's currently a senior research fellow at the Humanitarian Policy Group at ODI, which I think is the official name now. Used to be the Institute in London. Dustin.
Sorry. Thanks, Ron, and thanks to the organizers and PMAC for bringing together this conference. It's excellent to be here. I'll preface all of this with, we're talking about these technical issues, drivers of migration, and I think we can't overlook, maybe the elephant has been overdone, but just the global economic structure, neo-colonial structures of the economy and how that drives migration from global south to global north and across between locations, and the deep inequalities, particularly, I think Oxfam released a report in the past couple of weeks about the high concentration of wealth, with just a few billionaires have hundreds and hundreds of billions, wealth bigger than many different economies. So we're not going to talk about that. I kind of feel all this other discussion about migration, about refugees, about displacement is kind of window dressing on these much bigger systemic issues as well. So I'll just get that out of the way to start with. I'm going to talk about two main points. I've got limited time, but yeah, basically holistic solutions and local leadership are going to be my two main points. I'll try to weave together something that is coherent, even though I do have notes. So if we all go back in our memories to March 2020, I'm sure that's pretty vivid still, unfortunately. Sorry to bring up any trauma of that period, but it was interesting. I was working very closely with a lot of Somali civil society actors in March 2020 and the ensuing months. And yeah, all of a sudden, this is a context with huge amounts of displacement within the country, external as well, and a very internationally dominated humanitarian system for many, many years. And then all of a sudden, overnight, all the international humanitarians have left Somalia, and all the international humanitarian organizations with staff that stayed, predominantly national staff because they had nowhere else to go, were stuck in their offices and wouldn't do anything. So all of a sudden, speaking to my Somali friends and colleagues, COVID kind of decolonized the humanitarian system temporarily in Somalia. And you had all these civil society networks going out and going, okay, now is our time to shine. They were given extra funding, extra support, less oversight, and really able to do some profound, locally led response to the COVID crisis. This meant working particularly closely with religious leaders, with clan leaders, doing very culturally appropriate health messaging, behavior change communication, all these type of things. And it was really a profound moment in Somalia at that time. And it was one of many, many countries that's like, oh, COVID, you are horrible, but you've also helped decolonize some of our archaic, internationally dominated humanitarian system. Then as time went on, all the international actors kind of flooded back in. And as of 2022, direct funding to local and national humanitarian actors is actually worse than it was in 2019. It's down to about 1 to 2%. So it's actually declined. And you have, again, resumed this like international dominance of the humanitarian system. That was 2020. When we fast forward a year, we had Myanmar has come up a few times, so I thought I would just bring this in. You had the military coup. So any international actors that were still in the country then gave them a second reason to get out of the country. And all of a sudden, the humanitarian system decolonized again, temporarily. But what was also profound is that the best work across all of Myanmar, and this continues as of today, 3 years after the coup, is entirely locally led. We talk about health, we talk about humanitarian resistance, and this has been profoundly driven by Myanmar's civil society actors. Networks upon networks, reaching areas. We talk about these access issues across much of the country. You have an abusive military, but local networks have been exceptional at being able to reach all these areas. They're also this intertwining of humanitarian response with this idea of humanitarian resistance. A lot of the health system were the first people to go on strike against military rule, sustain that strike, set up parallel health systems to serve the most acute health needs across much of the country. And it was really this kind of great turning point in how humanitarian systems operate in Myanmar. Yet, as we kind of plateaued a bit 3 years later, you again see the return of international actors and this kind of going back to this kind of international inertia of we have a system dominated by international actors, whether that's INGOs, UN agencies, donor interests, and we're kind of back to square one in many ways. So I just want to bring those as two kind of examples of the importance of local leadership and how, given a nudge, willingly or unwillingly, that can have profound impacts across many different contexts. We talk about health outcomes, reaching displaced populations that often can't even cross a border necessarily, and being able to invest in and support local leadership is absolutely critical. So that's one aspect, this kind of importance of local leadership. Then I kind of wanted to bring in this, I'm trying to tie this into health as well, which is not necessarily my specialty, but there's kind of holistic approaches. And so at HPG, Humanitarian Policy Group, we've been doing a lot of research around well-being and the importance of well-being. And it kind of has resonated a lot through today and the rest of the conference. There's a lot of like focus on vaccines, a lot of focus on technical issues. But what we've been trying to push through our research on well-being is this idea of, particularly for displaced populations, of, what are the actions, what are the interventions that we can do, whoever we are, local, national, international actors, to support a broader holistic idea of a displaced person's well-being. So when we treat it just in technical terms, okay, you need $10 in Cox's Bazar for your monthly food, you need a certain vaccine at a certain time, you'll get your food at a certain time or your cash at a certain time. These are all different forms of control, and that limits people's well-being. So what we're trying to push through some of this research is actually what can we do within the means of the humanitarian system to really kind of engage with these more holistic ideas of what is a displaced person's preferences, how can we support their general well-being aside from just minor technical interventions, and also recognizing technical interventions can have very negative impacts on well-being. This also ties into broader issues, and we think this has come up in research in Syria and many other places as well, of this lack of rights to movement and lack of work rights, and how these are two of the fundamental impediments towards the well-being of displaced populations. So I come from a humanitarian space particularly, but then what are humanitarian actors doing aside from alleviating immediate suffering to also kind of advocating and trying to push for this systemic change to improve working rights, improve rights of movement within countries rather than being kept up in border camps, for example. Now, bringing this together again, this kind of ideas around local leadership, needing to approach issues holistically. I kind of want to bring this down as well, and we look at drivers of conflict. And I kind of want to bring all these different strands together with one example taking us back to Somalia. So Somalia, very well known for a lot of armed conflict, insurgency from Al-Shabaab, a radical Islamist group, and famine, perpetual drought. It's kind of like the tip of the spear of what the climate crisis looks like. And so you have this kind of whole narrative, but then in recent months, particularly the past year or so, the government has been making great strides, not just in governance and achieving debt relief, but then also in going on a counteroffensive and liberating many parts of Somalia from the rule of al-Shabaab. And for the first time in a long time, there's been this kind of hope within the country that there might be a post-al-Shabaab era, and there might be stability, they might be able to, address a lot of these drivers of why people need to or want to flee Somalia. So going into this very granular context, but this is one of many contexts across the world where you need to engage with such granularity, you get these newly liberated areas, and nobody from the international community is willing to really put money into those liberated areas. They're never willing to visit because of security concerns, which is understandable. But what you have is all this concentration of aid dollars and services in urban centers and nothing in these newly liberated areas. So you get a newly liberated area, everybody's suffered severe shock, trauma, lack of food security, yet there's no services being delivered in those areas. And then how do you sustain, and the government is really pushing this in Somalia, we need to get services out to newly liberated territories. That is the only way to kind of keep al-Shabaab at bay and kind of bring the community, bring the population along and kind of address this kind of systemic driver of armed conflict and displacement in Somalia. So again, it's local actors, local civil society actors, also the local government as well. It shouldn't just be one or the other, but really trying to push this agenda of how do we reach out to these populations? How do we therefore use, health services, or particularly one, food security and other aspects to ensure, okay, the government has liberated this area, now we can support that. But also it requires the international community to shift away from concentrating aid with international actors, but also in these urban centers, and really being able to have aid work hand in hand with the counteroffensive in Somalia. Now, I bring this just as one example. It's probably obscure and not something you'll necessarily remember, but there are so many contexts across the world where aid continues to be stuck in this kind of inertia, concentrated in certain locations. The warehousing of displaced populations is really problematic in many contexts. And how can we kind of, get into this granularity, shift away from internationally dominated ways of doing things, support local leadership, then also this idea of, holistic approaches. So when we think of the Somalia example, a holistic approach means, engaging with conflict dynamics, recognizing the needs and preferences of displaced populations, and being able to adapt to that to kind of, prevent this relapse into al-Shabaab control. So I just want to leave that there with just a few thoughts, remembering this kind of well-being, also the importance of refugee-led organizations, which HPG has been doing a lot of research on. We talk about local leadership, holistic approaches, and I will leave it there because I'm out of time, but thanks for listening.
Thank you very much, Leslie. So we have one speaker left, and I want to say that migration that we've heard so much about so far is not just a political issue, a legal issue, a humanitarian issue, a health issue, but it's very, very non-political as well. And some of, I'd like to introduce our next speaker, Baggio, who will speak to us about University in Rome. Has a close association with migration. I invited him to close the session by speaking about some of these more social and moral issues that we are facing in providing assistance to this very vulnerable population that we've been talking about all session long. Father Baggio, I think you're on the line.
Yes, you're him. Can you hear me?
Yes, we can hear you, but we can't see you. Do we have visual also for us? Well, go ahead, Father Baggio, go ahead.
Thank you, thank you. Well, thank you for the invitation. I'm really honored to be part of this wonderful panel. In the past 60 years, we have witnessed a considerable increase in migration flows all over the world. It is not only a matter of numbers of people on the move, but also of geographical scope and numbers of countries significantly involved as departure, transit, or destination places. As a result of the different globalization processes, the beginning of the third millennium has been remarkably characterized by human mobility. Regarding the drivers, I would like to point out three elements that I consider the main causes of contemporary and future migration: global inequality, conflicts, and climate crisis. Today, everything comes under the laws of competition and the survival of the fittest, where the powerful feed upon the powerless. As a consequence, masses of people find themselves excluded and marginalized, without work, without possibilities, without any means of escape. Pope Francis. In such a scenario, migration becomes the only credible way out. Inequality is strictly related to conflicts, a second relevant trigger of human displacement. The first 23 years of the third millennium have been dramatically marked by violence and conflicts in different regions of the world. As Pope Francis has repeatedly stated, we are assisting to a third war fought piecemeal, which threatens to become a genuine global conflict. And sometimes I wonder whether the current battlefields aren't just distant scenarios of someone else's war games. Inequality is also related to the climate crisis, since resources for resilience are not equally distributed. Fierce storms, violent hurricanes, and disastrous cyclones continue to rage. We see growing numbers of people displaced on account of the crippling impacts of a climate crisis and other manifestations of ecological crisis. Climate crisis is also related to conflicts. In some situations, climate crisis leads to the depletion of natural resources, which in turn can spark conflicts between communities and nations for the possession of scarce resources. Regarding the paradox of a development-migration nexus, in my opinion, the two opposite facts are on the one side the lack of development or development possibilities as one of the main migration drivers, and the development potential of migration on the other. Actually, the starting point should be the very concept of development. In many cases, the emphasis on economic indicators seems to promote a consumeristic understanding of development. The United Nations reacted to this by coining the terms human development, that refers to the condition by which people can enjoy longer, healthier, and more creative lives. From a Christian perspective, we are used to refer to the integral human development, meaning the total fulfillment of the whole person and of all persons, as individual, member of a family, and member of a community, in accordance with the unique and unrepeatable character of each human being. Such a personalistic approach leads to a concept of development, that it is indeed flexible and dynamic. However, it doesn't jeopardize the possibility of defining universal indicators of development. From my previous experiences, I try to identify some indicators of what I like to call sound development: holistic, sustainable, environmentally friendly, inclusive, encultured, locally grounded, gender sensitive, and responsibilizing. The first element of a paradox is the etiological connection. In most cases, this is precisely the lack of development, real or perceived, that is the main reason for the decision to migrate. And even in this case, the missing development should not be interpreted in purely economic terms. The second element is a contribution that migration can offer to sustainable development. Indeed, migration constitutes a great potential for development, but I believe that its release is not automatic. At least three essential conditions must be pursued: a coherent, realistic, and far-sighted potential framework both at a national and international level. A favorable equation between the costs and benefits of migration, and the participation of all actors, each according to their own prerogatives and responsibilities. Regarding the solutions, I would like to start from the urgent need for a global governance of migration flows. I quote Pope Francis in saying it is necessary to promote a common and co-responsible approach to the governance of migration flows. Several years ago, the international community embarked on this effort. As a result, in 2018, the Global Compact on Safe, Orderly, and Regular Migration and the Global Compact on Refugees were adopted by the vast majority of states. These two global compacts represent an historic enhancement in our shared responsibility to act in solidarity on behalf of people on the move. Nonetheless, we are still waiting for actions of concrete engagement. The first action entails joint and honest effort at eliminating the root causes of forced migrations. This commitment begins with asking what we can do, but also what we need to stop doing. We need to make every effort to halt the arms race, economic colonialism, the plundering of other people's resources, and the devastation of our common home. Pope Francis. Moreover, all political and social actors are called to a common commitment for the cessation of all conflicts, the end of hegemonic dictatorships, the elimination of persecution, and the prevention of natural disaster, particularly those caused by the abusive exploitation of natural resources. The second action is ensuring the minimum conditions through which each person, without exception, can be fulfilled individually and as a family. Equal participation in the common good, fundamental rights and personal dignity, and access to sustainable development. To achieve this, the main responsibility lies with the countries of origin and their leaders. However, their condition to be able to operate in this direction must be ensured without being repeatedly plundered of their natural and human resources and without external interference due to elite interests. There is also a significant role to be played by the international community within the framework of a global responsibility. The third action is building welcoming environments for migrants and refugees. Despite all development efforts, we must still expect huge migration flows in the forthcoming years. For this reason, we are called to show maximum respect for the dignity of each migrant. This entails accompanying and managing waves of migration as best as we can, constructing bridges and not walls. Pope Francis. The fourth action is ensuring regular and safe migration channels. We should start by providing fair and reliable information to prospective migrants and displaced people in countries of departure. Security is indeed a sheer concern, but whose security is at stake? We need to multiply our efforts to combat the criminal networks that exploit the hopes and dreams of migrants. It is likewise necessary to indicate safer routes. The fifth action is promoting the dialogue among demographic, economic, and migration policies to overcome the evident disconnect. Evidences reveal that there is more disconnect than nexus between migration and development policies, both at the national and local levels. This is frequently true also in countries of destination, and that disconnection also entails population policies. It is clearly necessary to bring demographic and economic policies into dialogue with migration policies for the sake of all those involved, without forgetting to put the most vulnerable at the center. Pope Francis. Thank you.
Thank you very much, Father Baggio, for those excellent remarks that bring us to the end of the presentations of this session. We've had a remarkable tour of the horizon, I think, of this problem. I think Unfortunately, we've heard more than putting it in terms of the keynote address this morning. We've heard more peril than promise, I think. But we know also that there is more than an economic imperative, a legal imperative, human rights imperative, a humanitarian imperative, a health imperative to do something to address this issue that affects really the most marginalized and vulnerable in our society. So I want to repeat what I said in my opening remarks, that I think that history might very well judge us by the way we treat those most downtrodden, those most marginalized individuals and members of our society. So I think it's very fitting that we end with a call for action and with a hope that solutions to these issues will be found, because very literally hundreds of thousands, millions of lives of human beings depend on it. Thank you. I promised that I would open the floor for more direct questions for the presenters, if there are any at this time. Yes? Yeah, could you maybe go to the microphone?
About the refugees that Rwanda have said they will take. Rwanda have said that to show that UK doesn't do its job. We need to be clear on that. Rwanda say you don't want them, we can take them. It's not for the money. And half of the population of Rwanda have been refugee at the time of their life. I was born a refugee, and other people has been refugee when I was an adult, etc. Now it's peaceful for more than 20 years. So I want to make the point that Rwanda have said that to show that Europe, UK doesn't do their job.
No, and I think the point is well taken, and I mean, we've seen that elsewhere as well, the responsibility shifting. It's not, countries can do it actually for, actually Cambodia, for instance, offered to take refugees from Australia because they felt that had a history of granting and receiving refuge elsewhere. You know, I think the motivations can be very mixed. So, I mean, I'll take your point on that.
Because in Rwanda, we have already a number of refugees that correspond to 1% of our population.
Yeah.
It's the only country where they have a health insurance automatically. And when it's not paid by UNHCR, it's given.
Yeah.
So that means there is a lot that country can do. And I want all of the people here to come and see what is done in Rwanda. They have the right to work. Of course, there is no work for many people, and there are a lot of Rwanda that doesn't have work. But if you have skills, you can go and you can even sleep in the refugee camp and work out. So it's free and open.
Could I just, I mean, thank you very much for sharing that. And actually, there are a number of countries in Africa that have very inclusive, good policies that we've seen. I think for us, the important thing is that, you know, there's not a responsibility shifting, that there remains a responsibility that's engaged.
Yeah, and shame to UK.
Yeah, exactly, exactly. And then both countries are responsible for upholding, you know, the rights of refugees. And sadly, in some countries we've seen, and I'm not commenting about Rwanda, I'm commenting about some in the Pacific, we haven't seen some of those countries able to uphold the rights that refugees have, which has been, you know, unfortunate, but it's the sending country that bears the major responsibility there.
Thanks for the comment and thanks for the response, Ellen. Let's take a question or comment from this side.
Hi, this is Irene, working for a family foundation based in Hong Kong. As part of our work, actually, we are supporting some of your organizations' work in different continents on IDPs and various kinds of disaster victims. So in view of what you share about the changing geopolitical landscape in different countries, may I seek your advice on some of the special things for attention when we, as an philanthropic organization, in making donation decisions? I ask this because as the head of my foundation, I'm also a former disaster management officer. I always struggle very much when reading the grant proposals. Because on the one hand, I noted that about the huge severity of the humanitarian needs in many conflict zones. But on the other hand, because I had also had some hands-on experiences in disaster management, and also with the partner, with the potential grantees, actually, we honestly discuss about the anticipated and expected operational challenges, not to mention those unforeseeable situations. For example, in Gaza, Turkey, etc. We do work in these areas. So with your regional observations, maybe you share some of the things that as a donor like us, what should be pay more attention? That would be really helpful. Thanks.
Thank you for your comment. Would anyone like to respond? Monette?
Briefly, because I've been in your shoes, I used to be a donor. And one of the things I find is a real gap. Well, there is a service gap, number one, that has been flagged by all of us, which is in these increasingly dangerous, circuitous routes that migrants are traversing through and asylum seekers to try and find safety. Our systems, national and humanitarian systems, are not set up to be able to follow migrants in transit. So there's a very concrete health need, but it relates to all of their social service needs and legal fees and legal needs as they move through countries that don't have a historical precedent around hosting asylum seekers for long periods of time. So I think that's a very concrete need, but from an advocacy and litigation perspective, a gap that I really see, particularly as we see this responsibility shifting happening, is there is no joined up advocacy that is happening across border. So if you look at the US and you look at Mexico, there should be very concrete, comprehensive strategies that bring together advocates for asylum seekers in Mexico, as well as the asylum seekers who are making it to the US. But you do not see that cross-border conversation. It is happening between the states. The states are collaborating all the time in figuring out how they're going to, manage migration, shift migration, and increasingly push it back further northwards. But what we're not seeing is the advocates saying, well, you're going to keep asylum seekers in Mexico. These are the needs that we have here in Mexico around health, around education, around legal services. You're not seeing that kind of joined up advocacy. So if I had a pot of money, that's where I'd put it. And you could look at every border and you'll see some of those same gaps.
Thanks, Monette. Yes.
Hi, I'm Sam Sellers, a contractor for USAID's Global Health Bureau. So, Monette, you started to get at this question, but I want to ask the panelists, so what? All of you offered critiques of the way that countries are dealing with issues around migration, but what should national governments in particular be doing about it? And I want to touch on 3 quick points. One around the ethnic heterogeneity of migrants. And Monette, you noted the Ukraine example, but Ukrainians are not Syrians, and politically are not, the politics is very different for responding to Ukrainians than to Syrians. So given the politics and the fact there's a lot of social science evidence around how greater ethnic heterogeneity can undermine social trust in certain settings, what you're asking national governments to do is to further undermine social cohesion in the service of accepting refugees. And I think that's a hard ask at this moment in time. The second point is around this idea of forced, which a number of you talked about. And there's a lot of migrants who are not refugees under the international definition, but who are moving from vulnerable contexts. And we know that migration is a multi-causal process, and it can be precipitated by both security and economic considerations. And so for folks who do not fit into the category of refugee, the politics is different there. And how do we respond to that difference in politics versus those who fit under that refugee definition? And the third piece is the effect on health systems. Health systems are strained all around the world in high and low and middle income countries. And refugees, particularly high influx in short periods of time, constrain health systems. What are the responses that have been effective in mitigating those strains? Thank you.
Thank you for that question. Enrica?
Thank you. Very briefly, I answer to the part what I would ask the countries. Well, to start with, and I'm referring here to European countries, is to apply standards that are already existing in terms of reception facilities, in terms of access to healthcare. Vast majority of European healthcare systems, they are based on universal access. That should be applied, but it's also complying to conventions on protection of refugees, as well as a UN Convention against torture. If all of these were applied, the situation would be already much, much better than it is. Thank you.
Thank you. Yes. No. At least I can't. I don't know.
Can I try, Ron?
Yeah.
Ron, is this
Yeah.
this
Go
is
ahead.
Xavier? Okay, can I just very quickly react to the question first, to thank the speaker for the question, but also maybe just to propose three very simple observations. The first one is, I think we need to be careful when we're talking about refugees undermining social cohesions and that leading to terrible trouble, because I think any quick glance as, for example, European history in the 19th century would suggest that even before the arrival of large number of non-European migrants, there were significant tensions, there were wars, there were revolutions, and there were a number of issues. So I think we need to be careful about blanket statements about the risk for social cohesion, especially when the number of refugees represents less than 1% of the total population. The second point, just to be very practical in responding to the question which was raised, what should governments do? I think from our perspective, I would clarify. I would summarize this into two or three key things. First is recognize that demographic trends are such that migration is going actually to be necessary in most destination countries. Number two, recognize that there are distinct types of movements and that they all need to be treated differently. I think that that was quite apparent in our distinct interventions. And number three, when it comes to refugees, recognize that many refugee situations tend to last, and therefore that it is prudent for destination countries, for host countries, to put in place approaches that can be sustained over time, both financially and socially, which is very often not the case, especially in low and middle income countries. Thank you.
Thank you very much, Xavier, for adding that. Very important. Go ahead.
I'm Wafa from Bangladesh. I work as a research fellow at Brack School of Public Health. So when we were discussing migration today, a term called economic migrants came up. So in the context of Bangladesh, there's a lot of internal migration from rural to urban, and a lot of it is attributed to climate change. While the reason why they migrate is to look for better economic opportunities, it is also true that they cannot go back home because there's often not a home to return to, as that home has been taken away due to climate change events such as flooding, land erosion. So when do we start addressing them as climate migrants, and how do we magnify or amplify the issue of climate as a reason for migration? Because when we say economic, it sort of takes away from all the vulnerabilities that these migrants face due to changing climate. I have another comment. When we were talking about health needs of these migrants, I believe that it's very important to move from a biomedical lens to a biosocial lens, because when these people migrate, the first thing that they lose is their social ties, which often makes them a lot more vulnerable to a lot of things. Say, when I leave home, I'm leaving my entire community and settling in a place that's very new to me. So they don't have social connections, which means they don't get their jobs, they struggle finding work, or even finding a place of stay because it's very new. So we need to really emphasis on the importance of these social ties, and really, when designing interventions, look at things from a more biosocial model. So I would like the panel to reflect on these. Thank you.
Thank you. Let me say in regard to climate migrants, one reason that we didn't put a major emphasis in this session on that aspect of migration is the vast majority of climate migration to date has been internal, and we really focused primarily on internal migration. That's not to say that this will not become an important problem in the future. Frankly, I think we have enough problems now, so we didn't really need to focus on. So thank you very much for your comments. Yes.
Hi, my name is Jar Jar. I'm from the Faculty of Medicine, Mahidol University, Ramatabadi Hospital. And I want to ask a question directly to Monette about your speech that you gave. I agree with every single one of like the actions that the US has taken, like the bans and everything. And I think that on some levels, it is somewhat inhumane to do that. So like I started asking myself, like, what is the extent, the responsibility, like the countries that are supposed to be providing asylum should have in accepting refugees, when any types of measure that they try to put to like try to reduce the inflow of refugees coming into the country can be seen as unjustifiable in the name of health equity or in the name of human rights. Thank you.
Yeah, thank you for that question. So, I mean, the question relates to what can countries do in the face of these challenges? I mean, I think, you know, countries have taken on international obligations, and at a minimum, that includes access to a process, a fair and transparent process that allows people to assert that they have a need for protection. And that's what we're seeing actually getting lost in a lot of these externalization processes, that asylum seekers are never getting to the starting point of being able to assert what their protection needs are. So that's number one. We need a fair, transparent process. You can expedite that process, but it still has to be fair. And so you need to look at the details of what that process is. Secondly, it can't all go through the asylum system. The major problem that we're seeing right now in the US, as much as in, you know, Europe, is that, you know, broader migration management pathways are not open for people who are migrating for other reasons. We've talked about climate. We're very far away from migrating for climate-related reasons. But, you know, Europe and the US consume a lot of migrant labor at all levels of the labor market, from physicians and nurses right down through agricultural workers. We need more of those kinds of mechanisms. And the problem is, what we're seeing right now is when they do develop these complementary pathways, it is directly at the expense of the asylum system. And I don't think it should be a zero-sum game. I think you need both. And I think a country the size of the United States should be able to provide both. And the final thing I want to say, it doesn't make me popular, but it is the sort of third rail of advocacy, which is if you have a coherent, comprehensive migration management system, you've given access to a fair process, due process that allows people to assert their claim to protection, we need to be able to talk about the return of people who don't meet those criteria. Nobody wants to talk about that. I think we are abdicating our responsibility as advocates if we don't talk about, well, what happens if someone has jumped through all those hoops and we've looked at their protection claim, we've done it in a fair way, we've created these complementary pathways, what do we do if they don't meet any of those criteria? States do have a right at a certain point to say, we will return you if you don't pass these criteria. But that's the sort of third rail of advocacy that nobody wants to talk about.
Thank you, Mona. Did you want to add to that, Ellen?
Yeah, look, I just wanted to say, I think, you know, Xavier and Monette and others actually have, you know, really hit the nail on the head in many of these things that relate to refugees. I just wanted to also pick up on that final point, because I think it is I think we have to, respect the rights of all people on the move, whether they meet the refugee definition or not. But I do think it's also right to say that, and the sovereign state issue is, yes, states have a right to control their borders, etc., but they've agreed to an exception, and that's for people who are in need of international protection. And I think that's where, when people are not in need of international protection, there may be other reasons why you can't return them home. They might meet some other human rights requirements, etc. But I do think for the integrity of the system, this is a question that has to be addressed. And sometimes we see people who are not able to be returned for other reasons, maybe because some countries don't accept back their nationals, except voluntarily, etc. So, I mean, I think it's quite complex. But I just also wanted to really reinforce the point that Xavier made about social cohesion. And I'd say just more anecdotally as an Australian, and I remember doing criminology studies at law school, and first of all, we saw the Italians come to Australia. They were all mafia, they were all terrible. Then we had the Germans, they were all Nazis, Then we had the Vietnamese, they were all drug dealers, But, over time, these things work out. And so I also would, say, please, we need to be careful with this social
I think
cohesion.
there are many examples of that, Ellen,
Yeah.
and I don't want to.
Yeah, and I just wanted my final point, because I feel I can't let it go unanswered from Dustin. Look, I mean, I take many of the points, and I do think it's really important to move towards much greater localization. But I just wanted to be clear that, UNHCR does not support warehousing, does not support food rations, etc. But, we work within countries where we have to abide by what the government policy is. So, but I just wanted to be very clear on that, because obviously I think, self-reliance and localization and all of these things are absolutely what needs to happen. Right, thanks.
I'll take one last very brief comment.
Doesn't have to undermine the hypocrisy of the Western world who come and push our people to go there when they have special skills. At the beginning of COVID, UK sent an announcement that all the nurses in Kenya, Tanzania, Uganda, Rwanda, Burundi are welcome to migrate. When we have less than you. So that means we cannot do one without the other. If you want the support of the civil society, both civil society and government institution, both sides. If not, it's just you come and steal our people that we need.
Thank you. Go ahead.
Yeah, I think you raise a really valuable point. And again, I'd take this like zooming out holistic lens, that a lot of this discussion is framed around this economic rationalism, economic imperative from a very global north perspective. And it's like, oh yes, let's facilitate the smartest, the brightest from...
It's not facilitate, it's call on them.
Well, yes.
We receive emails.
Exactly. So, and then if we talk about these structural economic inequalities between North and South, how are many countries across the global South meant to advance economically when all their talent is continually being poached? So I think it's a dangerous game when we continue to focus on this economic aspect instead of going, okay, how can we support not just vulnerable people, but also the best and brightest to be able to support and develop their home countries as well. And I think it runs this risk of this perpetual cycle of unequal development. So yeah, I think it's an excellent point.
Thank you, Dustin. I feel that it's time to draw this session to a close. I want to thank all of you for having attended. I hope it's been useful for you and that you've learned quite a lot. I have during this process. For that reason, I want to really thank all of the speakers, Xavier, Fabio Baggio online, the 4 speakers here who have really helped quite a lot shine a light on what has become an increasingly important issue in all discussions of geopolitics, human security, and health inequities. Thank you very much for your attendance. Have a nice day.